Good afternoon. Welcome to the Care 360 sponsored webinar, MACRA, 5 Big Questions Answered. My name is Colby Dix, and I will be serving as your moderator and host today. Our agenda for today is simple enough. We'll dive right into Kelly's presentation shortly, and there will be a Q&A session directly following. Please also stay with us for a brief overview of Care 360's complete suite of healthcare IT solutions at the end. I'd like to extend a warm welcome to our presenter today, Kelly Whittle. Kelly's bio is up on the screen now, and you can see that we're really lucky to have someone with such experience available to us. Her 20-plus years of dedication to healthcare IT and consulting has earned her great renown in our industry as a valued consultant and mentor. Welcome, Kelly Whittle.
Thank you, Colby, and welcome everyone to today's webinar on MACRA. This is Kelly speaking, and to orient you to my voice, I'll give you the 60-second overview. I am really passionate, as Colby mentioned, about simplifying the complicated and bringing stability to chaos. But perhaps my most exciting bit of information to share with you is that I live in beautiful Traverse City, Michigan. If you haven't been to Traverse City, it's a tiny little town that's growing by leaps and bounds. We are voted consecutively one of the best places for families to vacation. We're often referred to as the Caribbean of the North. If you haven't had an opportunity to visit us, let me extend a warm welcome. Today, we're going to cover MACRA in a very brief, short amount of time. We're going to cover it by exploring 5 questions. MACRA, as you might know, is 2,400 pages of content, and so we're just going to skim the surface, which will allow me to extend a second opportunity for you to document those questions. Go ahead and start sending them in so that we can get your questions answered. Colby?
Very good. Yeah, and our industry change does, of course, occur regularly, and it's hard not to feel some uncertainty when we're awash with all these endless acronyms that describe nothing short of a labyrinthian process surrounding reimbursement. In today's session, part 1 of 2, we are going to start with that overview of MACRA itself and try to explain it in a way that's both meaningful and useful to you in your practice. In part 2, later on in the middle of May, we'll be taking a deeper dive into the MIPS reimbursement track, which a majority of practices will be utilizing in the near future. But for now, let's begin. Kelly, why MACRA and why now?
Thank you, Colby. For those of you that are brand new to MACRA, MACRA stands for the Medicare Access and CHIP Reauthorization Act, and it is not an isolated program. If this is your first foray into the payment adjustment that's happening in our industry, rest assured that CMS is not picking on Part B payments in an isolated manner. There is a broader strategy that is underway. The industry is moving from fee-for-service to value-based care. The goal here is to drive simplification and to align our patients, our payers, and our providers in helping us to achieve better patient outcomes at a lower cost with the improvement of our population's health. You might identify this as what's been commonly referred to as the triple aim. The challenge is that there will be less money to achieve greater outcomes, which requires a brand new business model, which is exactly what MACRA is guiding us through, that transition to the new value-based business model.
I mentioned that swirl of acronyms during the intro. We may as well go ahead and address a few of them directly here. We've all become somewhat familiar with MU, PQRS, and VBM to some degree. And in some ways, it feels like MACRA is taking the place of some of these descriptors. Kelly, can you help clarify what it does and doesn't replace for us?
Absolutely. MACRA acts as an umbrella regulation, meaning that meaningful use, or MU, along with the physician quality reporting system, also known as PQRS, and the value-based modifier, VBM, are all being tucked under this new regulation referred to as MACRA. It doesn't mean that these individual regulations or the tasks and concepts that are associated with them disappear. MACRA isn't in an attempt to replace or rewrite those regulations. It acts as a covering to try to simplify and align them. However, MACRA does replace one of the acronyms we haven't talked about yet, and that's the SGR. If you're familiar with SGR, you'll know that it stands for Sustainable Growth Rate. This was an attempt by Congress to right-size the Medicare payments for providers. In the green box on the right-hand side, you'll see how the SGR was calculated. You'll see right from the very top that the calculation of SGR was very dependent on the national GDP. In fact, during the 2007 and 2008 downturn, there had to be a rework of the SGR configuration so that instead of it being an actual percentage of the real GDP, it became a 10-year average annual percentage, which is just one of the complicated criteria associated with how much increase or how much decrease was associated with the SGR each year. I think personally it's a good thing that MACRA replaces the SGR. We now have payments that are on a much more stable playing ground. Providers understand before they get started in treating patients what it is they will receive as a reimbursement and what it is they will not. I say good riddance to the SGR.
That helps a lot and helps to just put those terms into perspective as well. Another big topic of concern this year in particular is the potential repeal and replacement of the ACA, or Obamacare as it's widely known. Is there a sense that this whole new set of rules are in danger if the ACA is actually repealed?
Yeah, that's a great question, Colby, and it's one that gets asked over and over again. For those of you that monitor the industry blogs and news stories, you'll know that this is a repeated theme. The transition from one administration to the next administration always causes some uncertainty, but there was a heightened awareness of what the repeal of the ACA might do to the healthcare industry. We all watched with bated breath, and in fact, many of us slowed down our strategies and our transition plans in an effort to understand what the new administration might do in their repeal and replace of the ACA. It turns out that we're still waiting and watching. There hasn't been a repeal or replace at this point. The key here is to understand that MACRA and the ACA are two different pieces of legislation. The ACA, of course, is the Accountable Care Act, sometimes referred to as Obamacare. That piece of legislation is the one that the new Trump administration is taking a look at. The MACRA regulation is outside of the ACA and deals with the Quality Payment Program. Now, if you're not familiar with the Quality Payment Program, this is the moniker that CMS is giving to the new MACRA implementation. So QPP is an acronym that you should become familiar with. You'll find information when you're doing your research under MACRA as well as QPP. The reason that we feel in the industry that the MACRA regulation is stable and not likely to be influenced by the new administration is for the following reasons. First of all, remember that CMS is interested in moving the industry and the payments from fee-for-service to value-based care. The idea here is that we're going to find ways to provide better care more efficiently to improve the health of our populations. When MACRA was up for a vote, it received high bipartisan support from both houses and from both parties. This is pretty unusual in the current environment in Washington, D.C. As you know, there's lots of conflict and disagreement between the parties and between the houses. However, MACRA received favorable support from both. In addition to that, the MACRA regulation is separate from the Patient Protection and Affordable Care Act. And so that's the Obamacare piece. The two aren't connected. Third, MACRA is designed as a payment reform. We're really honing in on how do we drive efficiency in the industry. And without the MACRA regulation, there's definitely a gap or a space in helping the industry to make that transition.
That makes a lot more sense there as well. And so then, if we indeed go ahead and assume that MACRA is here to stay for a bit, that being the case, what are the key dates in the near future that we need to be aware of as it's rolled out?
That's a great question. I love when I think about the MACRA regulation, finding ways to simplify the over 2,400 pages of detail. The first thing in taking a look at that document was to determine how long did the regulation define activities or tasks that are covered in the document. And I can tell you it's about 9 years. So starting in January of 2017, all the way out into 2026, there are detail and provision associated with a MACRA regulation. So obviously, when we look at our timeline that we're providing you today, we're talking about just a narrow timeline associated with the beginning of the MACRA regulation, really honing in on what CMS is referring to as the transition year or the year of 2017. So we began our MACRA regulation in January, on January 1st. The first year of reporting follows the calendar year, so that's very logical. We're going to go from January 1 all the way through December 31st. In that time frame, groups of 25 or more providers that wish to use the CMS GPRO data submission process must register. So that happens on June 30th. So if you're part of those large groups, make sure that you log into GPRO, you get your registration, and you identify your providers by the end of June. Now, let me pause there for a moment and say there's no worries if you're a group that does not wish to use GPRO. There are other ways to report. So think strategically about whether you need to use the GPRO website or not. There are other ways to send in your data and to be compliant. It's just one of the options. Now, once we finish the calendar year and we have all of our data and we have all of our strategies completed for the 2017 year, CMS gives us a 90-day window, that first quarter of 2018, to actually submit our data. So March 31st of 2018 is the deadline for that first year submission. And of course, true to fashion, CMS loves to work in a prospective approach to payment adjustments. What you do in 17 will impact your payments in 2019. So whether you avoid a penalty or earn a bonus in the first year, you won't see those adjustments until 2019. And again, this is just a short snippet of what's happening under the MACRA regulation. The regulation covers over 9 years of detail. This is your very first year detailed on the timeline.
Well, that's great, and it certainly actually alleviates a little of that sense of urgency, the sense of a transition year certainly being rather key to that. Perhaps the most important question today for many in our audience relates to a sort of anecdotal, what's in it for me kind of question. Kelly, a lot of our outreach has shown that physicians and practices are concerned primarily with minimizing the strain of this new system on their day-to-day workload. Can you offer a few tips perhaps to help them to prepare without having to completely change their workflow?
Yes, absolutely. So in thinking about managing any transition, the first step is to understand what the impact of that transition is. And as we've already spoken today, value-based healthcare is absolutely here to stay, and it will expand and evolve over time. We're moving again from that fee-for-service all the way through value-based care initiated by MACRA, eventually to population health management. So MACRA is not even the end of the process for us in the industry. So to start to develop a strategy on how to manage your MACRA-based strategy, understand exactly where your current operations will be impacted by the regulation and the analytic capability. MACRA requires not only that you identify and track quality-based measures, that you have the latest technology, and that technology is 2014 CERT or 2015 CERT in your EHR, that you provide some engagement activities and operational improvement activities. It's one of the pieces of MACRA, specifically under MIPS. And then number 4, as we move into 2018, we'll be looking at efficiency. So that's the cost of doing care. When you think about your current analytic capabilities, do you have the ability to do the basics? Do you have the ability to identify quality-based measures and do the analytics associated with those measures? If you don't, the second step to preparing your practice is to begin to identify where you have those gaps. Where are there process gaps, operational gaps, and clinical documentation gaps? Think pretty broadly about your current state operations to give yourself enough of a view that you can develop a strategy on how to remediate any identified gaps. The third step is to create that action plan. So now that you've done your current state, you understand your current capabilities, you've identified your gaps, what needs to take place so that you can become compliant? And I love to write these down, whether you use a notepad or an Excel spreadsheet. Identify what those individual action steps are. Make sure you assign it to a responsible person and identify a date that's associated with completing the work. This will keep you on track and moving forward in a productive way. And then finally, if you are questioning what the MACRA impact is and you need to understand at a more detailed level how the operational changes associated with MACRA are actually aligning with your current state of operations, I recommend that you find a strong partner that has the skills and knowledge to help guide you through that strategy development. And there are all kinds of resources in the industry, no less Care 360 as one of those strong resource partners. Make sure that as you partner, you get clarity on your questions so that you don't undertake any unnecessary risks and inadvertently sustain losses. If you don't take action in 2017, you will receive a 4% penalty in 2019, and that's pretty significant.
It sure is. Thanks so much, Kelly. This was, really nice and concise in terms of the webinar. What's something we're really happy to be doing right now when all this is very much top of mind. We definitely always appreciate your insights. And I, for one, am already looking forward to part 2 and exploring MIPS in more detail as well. For now, we're going to transition into the question and answer portion. And just as a reminder, if you're watching WebEx in windowed mode, on the right side, there's a Q&A box where you can type in your question and hit send. And if you don't see it, click the Q&A icon on the top right to make it appear. And similarly, if you're in full screen mode, there's a Q&A button within the controls at the top of your screen. And please do stay with us after the Q&A for a brief presentation of Care 360. Kelly, we do already have a couple of questions that came in, actually. One, if you don't mind, is I have a very small practice and only see about 50 Medicare Part B patients per year. How does MACRA affect my practice? I think that refers to, there are some limitations for smaller practices in terms of MACRA, their necessity to report. Can you comment on that?
I sure can. That's a fantastic question. In an effort to help transition MACRA into an operational practice for the industry, the legislators have identified a pick your pace approach to the transition. Now, CMS has estimated that most eligible providers will actually fall under the MIPS portion of MACRA. And if you're not familiar, MIPS stands for the Merit-Based Incentive Payment System. It is the area of the law that allows you to pick your pace. And there are 3 levels of pace picking. You can pick a test pace, which allows you to submit 1 quality measure or 1 improvement activity. There's the partial pace, which allows you to hone in and do 90 days of reporting. And then there's the full pace, which allows you to do 365 days of reporting or the entire year of reporting. Once you've identified your desired pace, you'll need to confirm that you're actually eligible as a clinician under the MACRA law. And so those that are seeing a very small population of Medicare patients, Medicare beneficiaries, or if you're billing Medicare Part B payments in a small amount, you'll want to make sure that you're meeting the thresholds. And here are those thresholds. In order to be eligible to participate in MACRA, you need to bill Medicare more than $30,000 a year and serve more than 100 patients. Anything below that, below either $30,000 a year in billings or fewer than 100 patients, means that you can skip participating in MACRA this year because you are not an eligible clinician. Colby?
Excellent. Yeah, and I think that answers a couple of other questions I have in here. One was a bit more specific to are one doctor clinics obligated to enlist by June 2017? And I think the answer to that you kind of already hinted at, and it's not necessarily based upon the single doctor so much as their patient load. Is that correct?
So yeah, let's step back and clarify the June registration. Eligible clinicians do not have to register for MACRA unless they are choosing one specific way of reporting data, and that is only for groups of 25 eligible clinicians or providers and larger. So these are for very large groups. If you plan to use the group practice reporting module that is established by CMS, that's GPro portal, then you need to register. If you are not a large group and you do, or even if you are a large group and you don't plan to use GPro, then you do not register. So only one type of group needs to do any registration. Everybody else will just develop their strategy, work through the process, at the end of the year and into the first quarter of 2018. At that point, you will begin to submit data. And again, your strategy is so important because there are a variety of ways to submit data under MACRA. You can submit it through qualified registries, you can submit it through claims, you can submit through attestation. So make sure that your strategy is aligning with your pace and the desired outcome for your program. And I know we don't have an opportunity to go into every single detail. There's a lot of decision making to be made around that strategy.
Another question that popped up here that I've also heard in the past, but is there any way to be compliant with MACRA without having an EHR?
Oh, this is my favorite question because the answer is yes. In the year of 2017, paper-based offices can absolutely avoid the 4% penalty for 2017 by participating at the test level of MIPS. You have the opportunity to choose activities or improvements that fall outside of the need of an EHR. This will allow you to avoid that 4% penalty coming in 2019. Now remember that when you get to 2018, this is not an option. So use your 2017 year wisely. If you are practicing medicine in the long term, make sure that you are prepared with an EHR for the year of 2018. But in 2017, this is your year. You can still avoid that 4% penalty.
And then this one I know we've already touched on as well, but I'm going to try to just focus for clarity on it. The question here being, what are the minimal requirements that a small practice can expect to have to complete in 2017?
I love the fact that as awareness of MACRA gets out, people get excited because you start to move away from this is daunting and overwhelming to, hey, I can actually find a way to succeed that aligns with my internal resource capacity and my goals. And so this is the really exciting part of understanding MACRA. Under MIPS, again, with that choose your pace participation level that I referred to as test, partial, and full, if you're a small practice and you just want to avoid that penalty, you want to do a little bit of work, start to understand how the concepts are going to impact your operations, I recommend that you look at the test pace. It requires that you share data on one quality measure or one improvement activity or 4 or 5 advancing care information measures. And now those performance categories, quality and improvement activities and advancing care information measures, these are the categories that you will be scored on this year. But under the test pace, you only have to choose one of them. So a perfect example is if you are still in a paper-based environment, or you're just working on getting an EHR, a perfect approach to being compliant in 2017 is to participate under test and to take a look at the improvement activities. You need to find one improvement activity that you're committed to implementing in your practice, and there are over 90 of them to choose from. By processing that implementation or improvement activity and responding to CMS in the right attestation form, you actually can avoid the 4% penalty. So it is very doable this year. Now, there are benefits to participating at a broader level. One is that by participating at a broader level, you can see the full impact of what the transition and the change in business model will do to you in 2018 all the way going forward into 2026. So I encourage you, if you have the bandwidth, if you have the objective that you are looking for a bonus associated with your effort this year, I encourage you to participate at a pace larger than the test pace.
One more here. Is there a cost associated with registration or reporting to MACRA, to CMS directly?
Yeah, that's a great question. Again, if you're reporting through the G-Pro portal, I'm not remembering a fee associated with that. And again, that's for large groups of 25 providers reporting as a group. I'm not recalling a fee. If you're reporting through a qualified registry, and remember, there are various types of registries that will take your data and pass them to CMS, the data to CMS. There are typically fees associated with that registry work. So you could be looking at your specialty-based association, like the American Radiology Association. They do have a registry. They help radiologists identify which quality measures are associated with radiology, and then they will take in your data. They will do some data massaging, cleaning up, and preparing it for delivery to CMS. So that's one type of registry. There are others that you could participate with as well. There are EHR companies that are providing access. There are consulting companies that provide access. And again, the level of service varies greatly. So there are some fees, but there are some value add benefits associated with those providing MACRA transition services, like dashboards and feedback loops and education and awareness, so that your quality data is as clean and as compliant, so that you get, hopefully, you are associated with a higher opportunity to earn a bonus. So lots of decisions to be made around strategy.
Consideration of time. We're going to go ahead and close the question answer for now. Rest assured there are plenty more questions here. Kelly, we're going to go ahead and triage these after the session, some to you and some that are specific to Care 360 and how we will be able to help everyone remain compliant and move forward with MACRA as well. So we look forward to answering all of your questions directly, and rest assured we will indeed do so. Kelly's contact info and resources will be included as part of the follow-up documents as well. You'll also get these slides in a PDF format so that you can review this, and the recording of the session as well. You'll receive